Will the committee supply please come to order? This section of the committee supply will now resume consideration of the estimates for the Department of Families. Questioning for this department will proceed in a global manner. The floor is now open for questions. The member for the Paw-Kemisac.
Thank you, Mr. Chair. It's always an honor to be here today and have the opportunity to ask very important questions for our minister to answer. Obviously a huge department. And in particular, my interest is within CFS. And my first question is, can the minister tell me the number of family reunifications that have occurred through CFS in the last 3 years? So that would be fiscal years 1920, 2021, and 2022. I go, sir.
The Honorable Minister of Families.
Thank you very much, Mr. Chair, and I thank the critic for asking that very important question about really the number of children in care and where they're placed and how many reunifications there are. That is what our goal and our transformation is really centered on, is reunification as well as prevention. And the numbers really bear out that we are working towards preventing children from coming into care, having a significant reduction in apprehensions, and not placing kids in care in the care of someone who's not known to them, whereby we're trying to keep children wherever possible with community and with family. So I do want to just provide a little bit of context for the member in regards to the number of kids in care overall. And in the annual report of the Department of Families this year, you'll note that as of March 31st of this year, there were only 9,196 children in care. I shouldn't have said only 9,196 children in care, because that's still that's a lot of children and families that we're still working with. But everyone in this room will note that this is a significant reduction in the number of children in care from previous years. And I do want to point out that 8,571 of those children, or 93.2% of them, are placed in home-like settings such as foster homes with relatives or those with significant connections, and then or in places of safety. And then 3.8% are placed in group care resources. So we also felt that that was a very important strategic shift in terms of making sure that when children do come into care, they are either in a place of safety or a foster home, and a significant reduction in the use of those emergency placements and other environments in which the child may not have a community, family, or cultural connection. In terms of the reunifications, in 1819, there were 2,776 reunifications. In 2019-20, there were 2,406 reunifications. And in 2020-21, which is the latest figures that we have, there were 1,856 reunifications. Now, the reduction in the number of reunifications is a total reflection of number one, the reduction of kids in care overall, but more significantly, the reduction of kids not being placed in places where they have a connection, whether it be a community or family connection in the first place.
The member for the Paw-Kemisack.
Thank you, Mr. Chair. I heard you mention safety within foster homes. As an MLA for the Paw-Kemisack and as a foster parent, foster kids, I received many complaints about unsafe foster homes, and I have sent you several emails to numerous ministers of families with concerns. There's no way you can talk to a warm body when you talk to a CFS agency such as OCN CFS to get answers or to make a formal complaint. Mine fell on deaf ears. What does one do when one gets a complaint about an unsafe foster home and nothing is done 95% of the time, especially within smaller communities and more remote communities, because there's really nowhere else to put them, right? So that's what I want to know. How are these serious complaints, allegations dealt with when I get a generic email telling me, talk to the social worker? That doesn't help. I go say.
The Honorable Minister of Families.
Thank you. I do want to get a clarification from the critic when she said that 95% of the time. Are you referring to 95% of the foster agencies that you've dealt with are unsafe, or are you referring to 95% of the time your allegations of inappropriate conduct happening in a foster home has not been taken seriously?
The member for the Paul-Kamisak.
The second part. The second
Were you
part.
saying 95?
The Honorable Minister of Families.
So I understand what you're asking. You're saying that 95% of the time, your allegations of misconduct happening in a foster home has not been appropriately addressed.
Yes, and by
The member for the Paul-Kamisak.
yes, and by others who have made similar complaints, such as myself, where my nieces were in unsafe homes. My girl was HIV positive. She was sent home with bald oral injection, so the measurements weren't even taken seriously. I was accused of allegations too, and and other foster parents who have come to me as well, and relatives trying to get their relatives back in their home. Many times, our phone calls are not answered back. Many times, our emails are not answered back. It's like they don't want to be accountable for what they say. And it's very frustrating when you feel the agency took your children as hostages and you cannot find out information about them. You cannot, like even me trying to set up a family visit, they don't call me back. It's been 3 weeks now, and the adoption process I've requested 2 years ago, it still hasn't started. So many foster parents feel that, and parents and family, I should say families, feel that when their children are taken away, they're taken away as hostages, because when we try to ask questions about our children, we don't get any answers or a warm body to talk to. So they come to me sometimes because they hear I'm the critic for families. They think I could possibly help reunificate, get families back together because of my role. But it doesn't work that way. And it's really frustrating when we advocate on behalf of families, especially for trigger-happy apprehensions. We get no answer, Minister, nothing. And I'm almost at tears because I'm not the only family that's going through this. So I think this is a very important setting to let your staff know. We do not get answers. It's another residential school system.
The Honorable Minister of Families.
So I understand the member's frustration at being the critic for CFS or the critic for child, youth, and families and not being able to get answers directly from the system. But I would like to reiterate what happened in 2006 and how the system was reconfigured by the former NDP government that really has removed that provincial oversight layer that the member is seeking right now in her role as a critic. So what we have in our devolved system is the CFS agencies are responsible to the authority. So if the process is, if there is an allegation of any allegation made against a foster home, they are licensed by the agency. The agency is the one that conducts the child abuse registry check. The agency is the one that issues the license to the foster home. The agency is the one that has the overarching legislative responsibility for that foster home and the conditions therein. If there is a challenge with the CFS agency, then that appropriate channel is to take it up with the authority. And the authority is got that overarching responsibility for the agency. And if the authority, they provide the oversight to the agencies, and the authority is mandated by a board. So that is the structure. That is the structure that's been in place since 2006 under the devolution that was undertaken at that point. And so if your question is asking me specifically, or my department officials here specifically who work for the Department of Families, why they can't go in and directly manage, operate, or control the activities that happens at a foster family, at the foster family level, or even at the CFS agency level? The answer is found in the legislation that was brought forward in 2006.
The member for the Paw-Kemisak.
Regardless of 2006, apprehensions with Indigenous families are still pretty high. And the authority is still quite useless. No disrespect to the people who work there. I would never want to work within an organization like that when it comes to pretty much the business apprehending children. I can see when it's done, when it should be done, but in my eyes, especially with my family, it's a lot of the moves and decisions are very unnecessary and destroying families. So again, no disrespect to the staff, but again, the authority, we have went to the authority, again, fell on deaf ears. We even went to the, people even asked me, what is the role of the Manitoba advocate for the children and youth, thinking the parents wanting to use that avenue as a way to help their children. So again, no disrespect, the authority, there was no effectiveness there at all. And I am talking to department staff and you as the minister, as the leader, that's who I'm addressing this to. Agusa.
The Honorable Minister of Families.
Well, I can assure the member that no departmental staff actually sits on the board of the authority. And there's a process for appointing those members to the board, whether it be the Northern Authority, the Southern Authority, or the Métis Authority, or the General Authority. But I can assure the member that department staff don't sit on that board. The board is has its own governance structure, and it's not accountable to the Department of Families.
The member for the Paw-Kemisak.
Thank you. My next question is, can the minister tell us what is the current average caseload for our CFS workers?
Before we get the minister's response, I would just like to remind the committee, all committee members, that rather than referring to members of the committee as you, I would ask that you ask or refer to members by their ministry or their constituency name. So just a reminder from that. And I would call on the Honourable Minister of Families.
Thank you very much. In regards to the member's question regarding the caseloads that are handled at each agency, of course, the member knows that the agencies are responsible for ensuring that their workforce has attainable and sustainable workplace practices and are responsible for the case management of each social worker that is employed by the CFS agency. They are employees of that CFS agency and not the Department of Families in the cases of the agencies under the Indigenous authorities. What I do want to highlight, though, is that agencies also have the authority to reallocate funding where they see fit, whether it be in hiring more personnel, working on preventative issues, or any other appropriate expenditure that they deem an importance for their region. And so to put this into context, in March of 2018, when we moved to single envelope funding, which allowed the agencies to have that autonomy over their business practices, over their hiring practices, and over the management of their workforce, they were given the amount of money based on the number of kids in care at that time. That provincial number was 10,328. Today, that number has decreased to 9,196, and yet the funding envelopes have not been reduced. So by and large, most agencies have fewer kids in care, and yet they're receiving the same allocation as when they started receiving it in 2018. There has not been any reduction, and therefore they can reinvest in preventative care. They really have the autonomy as agencies to manage appropriate expenditures.
The member for the Paw-Camisac.
Thank you, Mr. Chair. PEGWIS was removed from provincial reporting of the number of children in care. You stated 9,196. How might the public get an accurate sense of the actual numbers of children in care over time? Are those numbers minused from the actual numbers when indeed those children are still in care? Egwasa.
The Honorable Minister of Families.
Thank you very much. And in regards to the member's question, I want to put on the record, it's not our jurisdiction to report on children in care that are not under the provincial jurisdiction. If they're in care under PEGWIS jurisdiction, those numbers are not reported under the provincial numbers. They're not children in the care of the provincial system. And that is really, that speaks to the larger area in which we're going with the transformation of child welfare. We have 6 other nations that have applied for coordination agreements in the province. And the way when an Indigenous governing body applies to the province to draw down jurisdiction and to repatriate their children and assume jurisdiction, our government, the role of the provincial government, as spelled out under the Federal Act and in collaboration with Indigenous governing bodies, is we certainly do not, we are facilitating and we're working collaboratively. We are providing them with the resources or the information that they need. You saw in the spring session, we voted in favor of Bill 41, which would allow the province the ability to provide access to information that the Indigenous governing body needed to deliver service, which we never had the authority to do that before. If we didn't pass Bill 41, we would have had the Indigenous governing body go to court, receive authority to access information about the children and families in their care. And we didn't want that. We wanted to facilitate the transfer of information. And so that was what Bill 41 had provided. That's just one example of how we are transforming the entire child welfare system. I think the last time we spoke about this initiative in last year's estimates, we were still at the precipice of moving forward on seeing this being implemented in the province of Manitoba. And in the last year, we've had some exciting development that has helped build that framework so that we can conceive of where child welfare is going in the province, but it's still in development and very, very nuanced. But we have a robust legislative agenda in front of us in terms of transforming the law to facilitate this, to assist Indigenous governing bodies that want to draw down jurisdiction.
The member for the PAW-Kemisack.
So after that explanation, Minister, to get the accurate number of children in care, regardless First Nation or regardless our own jurisdiction regarding the general, if you will, are there going to be 2 sets of numbers shared in regards to children in care? You know, because to me, overall, we're all Manitobans. So how is those numbers going to be shared with the public to still portray we still have a problem, you know, of high numbers of children in care? How are we going to have our own sets of numbers versus the general? I don't understand. So, and then the second question is, how is the PEGWIS process going? Agusa.
The Honorable Minister of Families.
So one thing that we have heard loud and clear is that there will not be the continuity of the child welfare system as it exists today in future years. That is what we've heard loud and clear from Indigenous governing bodies, Indigenous leadership, as well as numerous people who had reported on and provided testimony to the implementation of what was then C-92, the Act Respecting First Nations, Inuit, and Métis child and family, child, youth, and families. That Indigenous governing bodies have said loud and clear, we don't want the continuation of the provincial child welfare system as it exists today. And our role is in facilitating that transformation, which we all agree needs to occur. And so the province reporting on children not under our jurisdiction would just not be acceptable. It would not be for us to report on the status of children under the care of an Indigenous governing body that has drawn down jurisdiction. So while we may collaborate and work together with the leadership, we are not, those children are not under provincial care, and therefore it would be highly inappropriate and unacceptable for the province to be reporting on those children. In regards to the number of apprehensions that the member had raised in her question, again, that is certainly a byproduct of the system that is in place today, where we report on the number of apprehensions, we report on the number of children in care. And what we're seeing happen with Indigenous governing bodies that have drawn down jurisdiction is a redefining of child welfare and moving towards a more customary care where it may not be focused on reporting the number of apprehensions because there may be alternatives to apprehensions. We are really excited to be working and facilitating the this new era of child welfare.
The member for the Pas-Kamisak.
Thank you. The Assembly of Manitoba Chiefs brought forward a lawsuit with regards to the child and family system. What is the minister doing to address the discriminatory practices that result in apprehension of children?
The Honorable Minister of Families.
So I can acknowledge that we have received the statement of claim and are in the process of reviewing it, but as the member knows, this matter is before the courts and I won't be making any further comments regarding this case that is currently before the courts. The member had asked what we are doing in regards to discriminatory practices, and of course that is the whole process that we're undertaking on our CFS transformation. That is why we're moving towards a new era of child welfare. We're working collaboratively with Indigenous governing bodies who are drawing down jurisdiction to assume the authority over their own children, and that is why we are collaborating wherever we can with PEGWIS, which has already drawn down jurisdiction, and the 6 nations that have applied for a coordination agreement, and will continue to work in supporting that work, so that Indigenous governing bodies will assume authority over children in care in their community. But meanwhile, that is why our department has created a separate branch to deal specifically with this CFS transformation work.
The member for the Paw-Kamisak.
I'd like to ask again about PEGWIS. You know, how is that transition going? Is it going smoothly? I know it's a transfer of resources and services. Yeah, I'm really interested to know how that's going, since PEGWIS is in my constituency. So.
The Honourable Minister of Families.
Thank you, and I thank the member for the question, and we certainly do view PEGWIS as being a real leader in, not just in Manitoba, but in the country, in terms of their, the way in which they have moved to bring in their own laws and to exercise jurisdiction. We're very pleased to support them in the role that they're taking, and we have tremendous confidence in the leadership at PEGWIS for being able to really not only provide their children in the community the care that is needed, but really to provide a leadership role to other jurisdictions in Manitoba and outside of Manitoba who are in the process of drawing down jurisdiction, providing them with resources, support, information. And we're really grateful to the leadership at PEGWIS for playing this role. They were the first in Manitoba, and of course the first in the nation in terms of drawing down or exercising jurisdiction for children that were on reserve and off reserve, which is a tremendous first step for an Indigenous governing body in the country of Canada. What we have done to facilitate that, of course, I talked earlier about the bill that we had all voted in favor of in the spring session that would allow us to share information, and it would also allow them to access the CFS information system. It allowed us to transfer responsibility of any children that were in PEGWIS care to any children in the provincial care that were from PEGWIS to be transferred and become the responsibility of PEGWIS. And we have, they have their law, which is online. I don't have a copy of it here, but the member can go onto the PEGWIS website and read. They have their law, which is posted on their website, and it is what is governing their implementation of child and family services in their within their Indigenous governing body.
The member for the Paul-Camisac.
Thank you. I have one last question for you before I hand it over to my colleague here. What First Nations are next to assert jurisdiction over CFS? I know for a fact that I attended some meetings for OCN. We could have been the first First Nation, but then we had a new chief and council, which is another barrier. Priorities change, you know, and I can say that as a former, you know, counselor with OCN. And what was the most interesting part of that process is that they allowed an environment for the children to speak. They allowed a whole day for children who are currently in care or former children in care and share their experiences, which I firmly believe those voices are missing from this department. They're not listened to. It's ironic, almost like, you know, child welfare. And that's what I found so powerful about this process that OCN was taking. And all the stories the children were telling all sounded like residential school apprehensions, talking about the police and or CFS workers coming in, telling them they only had 10 minutes to pack up. They were described as nuns and priests coming in and doing such a thing. So I just wanted to know how many more First Nations are going to be, you know, eventually taking over their CFS jurisdiction. And again, change in chief and council, I can say that, you know, it's going to be problemsome. You know, priorities will change. So that's my concern, and I'm putting that on record. Egosep.
The Honorable Minister of Families.
So we have three different groups in which we're working with Indigenous governing bodies that are at separate levels of capacity building and in their own process. So the ones that are in active negotiation of their own coordination agreements and are on they're the most ready to assume jurisdiction are the Manitoba Métis Federation and Island Lakes Tribal Council, and of course the member knows about Peguis. There are three other groups that have already gone through the process of building capacity and have already begun the stages of developing their law. And those three groups include First Nations in Treaty 2 territory. It is a bit of an amalgamation of a few different First Nations that have come together and filed under First Nations in Treaty 2 territory. And then we also have a Pasquak Cree Nation and Tatasquak. And then in the third tranche of Indigenous governing bodies that are just really at the beginning stages where they're working on developing capacity, working on developing their laws, and are at the initial stages. Those include Sioux Valley Dakota Nation, Fisher River Cree First Nation, Pimachikamak, Mississippiwastic Cree Nation, Poplar River First Nation, and Lake Manitoba First Nation.
The member for Thompson.
First of all, I want to start off by saying I'm really grateful to be sitting across from Minister Clark. We've worked together in my previous role, so I want to thank you for being here. Thank you very much. So Mr. Chair, over the last 2 years, the department has entered into a number of sole source contracts for legal services, which hasn't happened before, including several contracts with Thompson Dorfman Swetman LLP, worth about $165,000. Can the minister explain what these contracts were for and why they were done through sole source?
The Honorable Minister of Families.
Great, thank you. First of all, I want to acknowledge my colleague here in the House. It's the first time we've had a chance to interact since your election. I want to say congratulations and welcome to this committee. In regards to the work that we do with Thompson, Dorfman, Sweatman that the member had referenced, I want to put on the record for his information that we've had a 20-plus year relationship with Thompson, Dorfman, Sweatman to do work on behalf of the Department of Families. And they are uniquely qualified to handle matters for Winnipeg Child and Family Services particularly. And we recently renewed that contract. There is a high volume of legal work. There are some suits against the department, as the member referenced in her earlier question, to name one. But we also did seek expertise from TDS in the past year in regards to the class action from Manitoba Developmental Center.
The member for Thompson.
Family Services provided MNP with a direct award of $251,000 in June. What was this for?
The Honorable Minister of Families.
So I do want to correct the member in that it wasn't a sole source contract. It was, we did issue an RFP, and MNP was a successful bidder. It was for $250,000, and this was to do work for us in regards to the new disability income support program. We needed a new assessment tool. We felt that they were best, according to their response in the RFP, they were best qualified to help us develop that assessment tool, and therefore they were awarded the contract after being the successful bidder of an RFP. If the member is referring to a different initiative, I'd like him to clarify that.
The member for Thompson.
That was the answer we were seeking, I guess. Okay, so I'm gonna, sorry. Okay, I can continue, okay. I'm jumping to the Manitoba Developmental Center in Portage, Prairie. There are currently 359 positions remaining at MDC. How many of those positions does the minister anticipate can be transferred to other positions in the department?
The Honorable Minister of Families.
Thank you very much. So when our government had announced the closure of the MDC, we had made a commitment that as long as there were residents still living at MDC, that they would be receiving the highest quality care, which meant we needed to have an active workforce in place until the last resident left the Manitoba Developmental Center, which is in an earlier committee, I had explained the process for care plans and continuity plans for each of the residents that the member can reference. So while that work is is ongoing right now, we are also working with the active workforce. So there are 282 part-time and full-time employees at MDC. And we are actively working with the health authority and the union to ensure that there is that there are jobs for each of those individuals when they are finished at MDC. We have taken many steps to ensure a successful transition when they're ready to leave MDC, but of course, we have also done a lot of initiatives to try to keep them there until they are no longer needed, because we recognize that caring for the individuals that still call MDC home and will be for another 6 months to a year, we need to ensure that they've got the care that they need. And I want to express my appreciation to each of these practitioners and employees who have stayed on and are committed to the residents to providing them with the care. In recognition of that, the work that they're doing, and in recognition that they will be transferring on, what we are doing is we're reimbursing all the MDC nurses for their licensing fees. We are also providing them with many training opportunities and initiatives to prepare them for work in the public health sector or wherever they may choose to go. But to answer the member's question as how many of the employees at MDC are we working to secure employment with beyond the date of closure of MDC? The answer is all of them.
Member for Thompson?
Thank you, Mr. Chair. With regard to the Manitoba Rent Relief Fund, how many loans have been provided, and what is the total value of the loans that have been given? How much money is in the fund available to be loaned, and what is the average loan provided from the fund?
The Honorable Minister of Families.
Thanks. I want to start by thanking the Manitoba Nonprofit Housing Association for working with us on this 2-year pilot that we announced, I guess, a year and a few months ago. As of July of 2022, we have approved 629 loans. That means that there were 629 people who were either precariously housed or facing eviction that were prevented from becoming unsheltered or needing to change housing or whatever the case may be in regards to their housing arrangement, that they were able to access a loan through the rent relief program and maintain their housing. So I also want to highlight that much of the loan applicants have been single parent households and others who were precariously housed or experience housing insecurity, who have now been able to achieve security and prevent them from experiencing homelessness because of this program. This program, when we announced this pilot, was touted as the first of its kind preventative initiative on preventing homelessness. Rent bank had never been established in the province before, and we're certainly looking at the successes of this 2-year pilot and looking to pivot to the future and see what that will be in the months to come. But right now, we're incredibly grateful to the Manitoba Nonprofit Housing Association. I know that it's been a tremendous amount of work receiving, opening up the intake, receiving the applications, assessing them, and then of course providing these loans. But they're very committed to the work and very pleased that they have been able to prevent homelessness in many of these cases.
The member for Thompson.
Manitoba Housing spent $17 million less than the previous year. My question to the minister is, why is that, and were there not projects to invest in?
The Honorable Minister of Families.
Can the member clarify where he received that number from? I can put a little bit of context on the record that last year the province did provide MHRC $128 million, and we did have a $302 million budget for the operations. Not certain we are able to determine that figure that he'd cited earlier.
The member for Thompson.
It was posted to Manitoba housing website, yeah, or financial page.
The Honorable Minister of Families.
If the member could provide a little bit more clarity in terms of what this figure was in reference to.
The member, oh, the member,
Oh, sorry,
the member for Thompson.
Manitoba Housing Annual Report spent $17 million less in 2021, 2022 versus 2020, 2021. Make sense?
The Honorable Minister of Families.
Thank you very much. So the 17 million that the member is referencing is is the fact that we've spent a lower amount in Waverly West. We've had a sale of land and lower expenditures in Waverly West, which has attributed to that figure. But while I have the floor, I do want to put a few other figures on the record in regards to Manitoba Housing, which is receiving an 8.5% increase or $10.9 million increase for 22-23. And overall, it has an approved budget of $138.7 million for the upcoming 22-23 year, the current 22-23 year, pardon me, which has an increase of an 8.5% increase from last year.
The member for Thompson.
How many social housing units does Manitoba currently operate? How many social housing units does Manitoba currently fund but not operate? And how many social housing units are currently vacant?
The Honorable Minister of Families.
Thanks. I'm happy to provide this update for the member. In terms of the direct managed portfolio, we have 11,520 units. In regards to our sponsor managed portfolio, we have 4,700 units. Those are units that are owned by Manitoba Housing, yet they're run by a sponsor, such as the Winnipeg Rehab Housing Corporation or another sponsor management corporation. We have 13,671 units under the nonprofit or co-op agreement. And we also have an additional 3,010 units that receive a rent supplement. Those are rent supplements that are specific to the suite. And if you want, when it comes to a rent supplement that is specific to an individual and not to the suite, those are individuals under the rent assist category. And right now we have 23,500 households on rent assist. These are benefits topped up for their rent, and it's mobile. It goes with them where they want. And then we have another 6,966 individuals who are not receiving EIA, but also receiving the rent assist top up from the province. Additionally, I do want to inform the member about the Canada-Manitoba Housing Benefit, which is a benefit of $250 a month for shelter top up. This is not tied to any suite. It is a mobile rental assistance that is available to any youth aging out of care, any person who is in recovery or experiencing addictions and need help with their rent, to recognize that they need long-term housing to sustain their recovery efforts. And this rental top-up benefit is available to them, as well as anybody who is currently unsheltered and who are moving into accommodation. They are eligible for the $250 a month Canada-Manitoba housing benefit. So I haven't added up all the numbers of households in the province that are receiving support from housing. But those are the numbers there. And in regards to the vacancies, there are currently, as of October of 2022, 1,886 vacancies. 69% of those vacant units are in the queue for refurbishment, or they're either currently being renovated or in the queue to be renovated. The remaining 31% are units that are chronically vacant due to location or other factors, and we are certainly working on addressing those. If they're chronically vacant due to location, of course, we have the Rural Homeowners Program and other initiatives to ensure that we have fewer vacancies.
The member from Union Station.
Yeah, I recognize that we're very short on time. I'm not sure if I'm allowed to comment on time, so I'm hopeful that the minister can provide a quick response to my question. It's in regards to Lions Place. I know the minister met with Lions Place just last week. Can the minister advise on the steps that she's taken to address the concerns at Lions Place, and would she take steps to ensure that it's kept social housing for those residents?
The Honourable Minister of Families.
Thanks. I was very pleased to meet with the committee from Lions Place, and certainly did take their concerns very seriously. They had one simple request of me at our October 3rd meeting, and that was to form a working group and be part of that working group. They want to have a conversation with other housing partners as well at the table. The federal government, the province, of course, plays a big role, as well as another nonprofit housing provider. They want us to all come to the table and meet and talk about initiatives, and the answer was absolutely, and I believe that meeting is tomorrow. An initial meeting is tomorrow of that working group.
The member for Union Station.
I thank the minister for that update. Is the minister committed to ensuring that those rents remain socially affordable for those residents, predominantly seniors?
Order. The hour being 5 p.m. Committee rise.